Hello, welcome everyone. My name is Lauren Underwood, and I have the honor of representing the 14th Congressional District of Illinois. Many of you know that protecting healthcare and making healthcare more affordable inspired me to run for Congress. The American Rescue Plan includes the largest expansion of health coverage and affordability in over a decade. This is real dollars in the pockets of Illinois families at a time when people need financial relief the most. These are policies I've been fighting for since I was elected to Congress, including my Healthcare Affordability Act, which lowers out-of-pocket premiums for marketplace plans. I am joined today by a very special guest who I will introduce in a moment to talk about how you can find out if these historic healthcare savings in the American Rescue Plan will help you and your family save money. President Biden signed the American Rescue Plan into law in March, and it's already helping to speed vaccinations, put money in pockets and people in jobs, and keep children in schools safely. You can find details on the new law at my website at underwood.house.gov. We have a whole page dedicated to what's in the American Rescue Plan and what it means for the 14th District. Because of the inclusion of my Healthcare Affordability Act, families in my district will see lower out-of-pocket healthcare costs through expanded premium tax credits, which Americans use to purchase Affordable Care Act plans on the health insurance marketplace. The lowest income families and those who qualify for unemployment insurance would have their premiums eliminated, and other hardworking families will save hundreds or thousands of dollars per year. Families who currently make too much to qualify for tax credits but still struggle with the high cost of care will now pay no more than 8.5% of their income on premiums. So for families in Northern Illinois who are paying 15, 18, or 20% of their income on healthcare, this is real savings that matters. Uninsured couples earning over $70,000 could save more than $1,000 per month on their monthly premium. A family of four making $110,000 per year in Illinois' 14th Congressional District could save more than $7,500 per year on healthcare premiums. It's important to note that these healthcare savings are not going to be automatic in most cases. People are going to need to take action. The provisions of the American Rescue Plan to lower healthcare costs went into effect on April 1st. So people can go to the marketplace today, like right now, to see what savings that they're eligible for. There are people ready and willing to help us. You can connect directly with the Marketplace Navigator. They are equipped to help consumers look for healthcare coverage options through the marketplace. They can even assist with eligibility and enrollment forms, all at no cost. You can connect with a local navigator at localhelp.healthcare.gov. And that's also what we're here to talk about today. Here to help us understand the marketplace and how a consumer can check their healthcare options is Brian Gorman, the Director of Outreach and Education at Get Covered Illinois. Thank you so much, Brian, for being here with us. First, can you introduce yourself and explain what Get Covered Illinois is?
Absolutely. Good morning, and thanks so much for having me. My name is Brian Gorman. I am the Director of Outreach and Consumer Education for Get Covered. Get Covered Illinois is a business unit within the Illinois Department of Insurance. We are the state's official marketplace. We assist Illinois consumers who need to enroll in a qualified healthcare plan through the Affordable Care Act. Typically, we do a lot of our work during the open enrollment period, which traditionally is from November 1 through December 15th. But as you alluded to in your opening remarks, there is a tremendous opportunity for Illinois residents who need to enroll in a plan or need to change their plan or make modifications to their existing plan to help save some dollars. So really excited to be here and really excited to share some of the information and news that's going to be so helpful to so many across the state and across the country.
Well, thank you. So before we get into any of the more specific questions about how someone can check on their savings from the provisions of the American Rescue Plan, I want to make sure that everyone has a basic understanding of the marketplace. So can you give us a bit of context? What is the marketplace and how does it work?
So with the passage of the Affordable Care Act 10 years ago, marketplaces were created as part of a law which allowed Illinois consumers who traditionally had been excluded from the individual insurance market, those folks who were not Medicaid eligible or Medicare eligible or had an employer-based coverage. Allowed them to shop for and compare plans side by side. So in Illinois, there's more than 7 carriers, insurance companies that offer plans. And based upon that shopping, there's also tax credits, or APTCs, advanced premium tax credits, which allow people to reduce the cost of their premiums each month. And so, where we are right now is an open enrollment period that will continue now through August 15th. So if you currently don't have health insurance coverage, now is the time to act. If you need to change your plan, now is the time to act. And obviously, with some of the amazing provisions within the rescue plan, there is a tremendous opportunity to save a lot of money.
And for those who've been following along in our conversations this week, you know that the tax credits are the same thing that our friends at Kaiser refer to as the subsidies. We're talking about the same provisions that help consumers save money out of pocket. Isn't that right, Brian?
That is correct. So people can receive these tax credits or subsidies in advance, and so they can reduce their premium payments. I think in Illinois, nearly 85% of the individuals who enrolled in a marketplace plan last year received some form of subsidy or credit to help reduce their premiums. And now with the passage of the American Rescue Plan, that number is bound to increase in terms of percentage, and those who currently receive those tax credits will see even greater savings each month. So it is a very big deal, the American Rescue Plan, for what it means for Illinois consumers.
Thank you so much. So let's dig into the new lower costs on the marketplace that began on April 1st as a result of the American Rescue Plan, and what actions someone will need to take in order to benefit from the savings. So first off, who would benefit from going to the marketplace to look at updated prices that started on April 1st?
The simple answer is everyone. If you're currently enrolled in a marketplace plan, or if you currently don't have health insurance. If you're currently employed through health insurance through your employer, you don't need to do anything. If you're currently enrolled through a Medicaid plan or Medicare, you don't need to do anything. But we're encouraging everybody else who's on the individual market who needs health coverage to take some time very soon to get covered. And as you mentioned before, the benefits contained within the American Rescue Plan, to take advantage of them today, right now, after April 1, people do have to take some action. So the best thing that people can do is go to healthcare.gov. Healthcare.gov is the enrollment and eligibility website that Illinois uses to select a plan. And when you go to healthcare.gov, there is a button that says receive an updated eligibility determination. It's right there on the homepage, and all you got to do is click a few buttons, update your information, and within the next month's premium, if those changes we made, you'll be seeing some savings.
And so if someone isn't currently enrolled in a plan, how do they check out the prices to see if it's more affordable and a good option for them?
Well, there's a couple things that you can do. As I mentioned before, healthcare.gov is the website that Illinois uses. You can click shop and enroll, and that will allow you to see all the plans side by side. I would add, if you have questions or you need information or help, getcoveredillinois.gov should be the first place that you should go. There may be a number of Illinois residents who want to shop for a plan that don't have coverage that may be Medicaid eligible. So we have a tool on our website, getcoveredillinois.gov, where folks can click shop and enroll. You answer 3 very brief questions about your household size, monthly income, and some other questions as well. And that will determine whether or not you are eligible for potentially for Medicaid or for the marketplace. If you're marketplace, then we'll transfer you immediately to healthcare.gov. And that's where you'll be able to see all the plans in your area side by side, not just what's who those plans are, what they cost each month, but what the savings would be with the new advanced premium tax credit increases each month. So it is going to require some effort on behalf of Illinois consumers to take advantage of these changes. But it's just a few short clicks away. So we're encouraging everyone just to take some time, even if you're enrolled in a plan, see something there as well. I would also say, and it's important to note that these benefits, if they do not choose to make these changes now, Illinois consumers will see those tax benefits when they reconcile their 2021 taxes. So it won't feel like lost money, but you'll be able to defer those savings when you file in your 2021 taxes next year. However, in order to take advantage of savings here today, they do need to go to healthcare.gov.
Okay, so I want to tease out a few things because you covered a lot. First is for current marketplace enrollees. So if you currently have an Obamacare plan, and if you don't log in affirmatively to the website to healthcare.gov right now to check out your options and the new pricing, then that's what Brian's saying, that it will be reflected when you file your 2021 taxes. Isn't that correct?
That is correct. So as you mentioned earlier, April 1 was his first date where people could update their applications or make changes. However, the law is retroactive to January 1. So you may have the benefit of actually getting a decreased premiums each month because of the rescue plan starting May through the end of the year. But when you file your 2021 taxes, those 3 months or however it is, I guess, before you made those changes, that updated premiums will be reflected in your taxes when you file for next year. So there are a lot of benefits within this law, and it's really important that people understand that this is real money in your pocket starting next month, but you do have to take some action in order to update your application.
Okay, so basically everyone watching, if you are interested, whether you have a marketplace plan or you're interested in a marketplace plan, you should go to healthcare.gov to check out the updated pricing. If you have a plan, you can check out the new pricing, you can make adjustments since we're in this special enrollment period, and you can take advantage of the lower out-of-pocket costs right now. If you have a marketplace plan and you do not take action right now, then you will see those savings if you have a marketplace plan when you file your 2021 taxes. If you don't have a marketplace plan and you want to enroll, you should do it now. You can't be passive and just wait and assume that something will happen. We need you to take action and visit that site. Anything else that viewers should consider before they make a change to their plan?
The one most important thing, everybody should update their application. That's one. But people are also eligible to change their plans during this special enrollment period. We would caution individuals to be thoughtful about changing their plan if they've currently utilized their plan. So to break it down, that there are deductibles that most insurance plans have. If you change a plan, that deductible may reset. So, I tell folks this: look, you brought up the issue of finding assistance, shopping for health insurance, despite the tools available. It aren't always the most intuitive and easy process. So here in Illinois, we do have resources to help walk Illinois consumers through what their options are. And you can find certified application counselors by going to getcoveredillinois.gov. You can find help. You can type your zip code in a number of different areas, and certified trained assisters free of charge will help walk you through what those best options are. So we want you to know that there are tools on the website through healthcare.gov to shop for and compare plans. But we also want you to know that there are free resources available for you saying, look, I just don't understand what's happening here. Please help.
And so you mentioned something about May 1st. So is that when the changes kick in? When will someone with a new plan be covered? And when would someone reselecting their same plan see the savings from the expanded tax credits?
So updates to the tax credits or subsidies generally take effect with the next month's premiums bill. So as a result, updated plan selections made on or before April 30th will result in tax credit increases on May 1. And then, hypothetically, if you do that in the next month, those will be reflected in June 1. So it is pretty amazing that people will see those benefits with the next month's premium bill.
Okay, so this is something that can happen over the course of a matter of weeks. So if folks do this right now, then they'll see the savings sooner. Is that right?
That is correct. So, if you're looking to save money, I mean, candidly, who's not looking to save money in their monthly bills? All you need to do is update your application. Go to healthcare.gov, click on update my application, enter in essentially refresh your current information, and then you'll see those savings with next month's premium bill. And it is significant. We're not just talking a dollar or two. For some families, this is significant amounts of money.
Yeah.
And as you mentioned before, the affordability threshold with the rescue plan has been lowered. So people will not be spending 11, 12, 13% of their monthly income on insurance. That's been standardized to a much lower rate.
That's right, 8.5%. We're pumping
8.5%.
Okay, so let's talk about, you mentioned the deductibles. I think folks know what a deductible is, but let's talk about why someone may want to reach out to their insurance company to handle this deductible issue. Can you just explain that a little bit more?
Right. So insurance companies are not prohibited from resetting the deductible, but you're going to have to reach out. It varies from plan to plan. And I want to just kind of make sure that we're very clear. We're talking about people who change their plan from one plan to another. Maybe your health circumstances may have changed throughout the year, and you want to take advantage of this rare opportunity to change plans in the middle of the cycle or middle of the calendar year. But it's important that if you change plans, that you reach out to your insurance company and find out what the deductible is. Essentially, the deductible is what you pay out of pocket before the benefits of your insurance company kick in. So if your deductible, let's say, is $5,000 or $1,000, and you use $900 on already, you may have to repay that $900 again before your new coverage begins. I would also like to take this opportunity to remind people that those folks who enrolled in ACA compliant plans, all your preventive care is covered free of charge. And we always tend to plug flu vaccinations and primary care physician visits, and making sure that everybody who's eligible and whose turn it is up takes advantage of getting vaccine. I know it's a little off topic, but I would be remiss if it didn't remind everybody that your preventive care with your ACA plans are included.
Brian, I'm so glad you mentioned that. So we've been seeing some comments and getting some outreach from folks who had ACA similar plans, but enrolled directly with that insurance provider and are wondering if these savings could apply for them if they actually enrolled within the marketplace. We're encouraging those individuals to reach out to your health insurance plan. Because this is something that affects many people across the country, and these health insurance providers do have a mechanism in place that they could apply to you and your family.
Indeed. And I also want to take the opportunity, I know that we're talking about the benefits of the American Rescue Plan and in the marketplace, but there are tens of thousands of Illinois consumers who are currently eligible for Medicaid. Illinois was one of the first states in the country which expanded ACA benefits to childless adults through our Medicaid program. And you may see even increased savings in there. And Medicaid, for all intents and purposes, has the same richness of benefits that marketplace plans have. So, depending upon your income, you may be eligible for free or low cost Medicaid coverage, which still has those same 10 essential health benefits that plans can be purchased on the marketplace. So it is a tremendous opportunity for those folks who don't have coverage to gain coverage during this open enrollment period, whether you're Medicaid eligible or marketplace eligible. And for those folks who are currently enrolled to save significant amounts of money, both in the immediate and obviously when they reconcile their taxes next year, both as a result of the expansion of the special enrollment period, which goes through August, and the passage of the American Rescue Plan.
Okay, so you just mentioned the special enrollment period. For folks who may not be familiar with the phrase, but may know about the concept, can you just help flesh that out a little bit for us? The Biden-Harris administration opened up the special enrollment period, and they extended it till August 15th. What does that mean, and who does it apply to?
That's a great question, because typically, as I mentioned when I first started, that the open enrollment to shop for and compare marketplace plans traditionally is from November 1 through December 15th. And if people had what they referred to as qualifying life events, if you move, if you get married, if you change jobs, birth a child, divorce, anything that kind of affects your household dynamics would trigger what they called a special enrollment period, which would allow you to shop and compare. And we're very excited that when the Biden administration took office, one of their first acts was to extend the special enrollment period for anyone to shop that may have missed the original open enrollment period to plan. And they've subsequently extended that special enrollment period, as you mentioned, through August. So anybody can fill out an application and get covered the following month. So here we are, it's April 6th. If you currently don't have health coverage for whatever reason, you chose not to enroll, you missed the deadline, you've experienced a qualifying life event, you just moved to town, it doesn't matter. You go to healthcare.gov, you fill out an application. That's where you can shop for a companion, the best premium plans, whatever may work for you, and you can enroll. So there really is next to any barriers for people to enroll. We know that they're affordable because we've established that 8.5% can be the maximum out of pocket that a consumer will pay each year. Many consumers will get no cost coverage through Medicaid. And as I mentioned before, 85% of those individuals in Illinois who enrolled in a marketplace plan did receive some form of help to subsidies or tax credits to help offset those costs. So it is a tremendous opportunity to really increase health coverage throughout the state and increasing for affordability as well.
So I have two more questions for you. The first is that I've been hearing about these additional savings for anybody who's been unemployed this year. And I know that those will be available starting in the summer. So what should those folks do right now if they need healthcare coverage?
I think that the basic answer to that is going to getcoveredillinois.gov. There's two things that you can find when you go to our website before you go to healthcare.gov, and which will eventually get you there. One, we can find in-person help. When I say I should say not in-person help, that you can receive that assistance free of charge telephonically or over Zoom virtually because of the public health emergency. We're encouraging people not to do this in person. And that's a great way for you to really understand what your options are. And particularly when you mentioned, those folks who need coverage, who may be unemployed, and as those other benefits kick in later this summer, you may be eligible for something now. And so finding out what your eligibility is, answering 3 basic questions could point you in the right direction. But the important thing, I think, for all of us, given where we are in this public health emergency and what this means moving forward, is to make sure that everybody understands that you all have access to health insurance coverage today, whether or not you're employed, whether that you are unemployed, or you're on an individual marketplace. There are a lot of options for you, and the choices that Illinois consumers have never been greater, and that we are between now and August 15th. But it is going to require some effort and on behalf of consumers to make those changes. So I'm really thrilled that you've invited me here today to help us spread the word.
Thank you. Okay, last question. If someone looks at these new rates and they still can't afford the coverage, then what should they do?
Well, obviously that if they can't afford the coverage, when they update their application, that will be reflected inside that point. So again, 8.5%. Nobody in Illinois or across the country should ever pay more than 8.5% of their monthly income. But I would also encourage people to again, find help. All of us don't know every single element about shopping for or comparing plans. A lot of our certified application counselors are affiliated with federally qualified healthcare centers. And they can actually provide those health services that you may need. But if you are not affordable, your income is below the threshold, it is very likely that you may be Medicaid eligible. And then you will still receive that same quality, affordable coverage at a reduced or more often free rate. So the worst thing that people can do is to do nothing and assume that there is nothing for them, because now more than any other period in recent memory, there are options for consumers.
Yeah. Oh my goodness, Brian. Thank you so much. I know that this will help a lot of people in our community. Before I let you go, how can someone get in touch with Get Covered Illinois or get assistance locally if they want help with anything that we talked about today?
The first thing is just go to getcoveredillinois.gov. At the top of the website, there is a link that says free help. Click that link, type in your zip code, whether you speak English or Spanish, and within 25 miles, they'll find a certified trained assister that can walk you through the process. The second step is if you're ready to shop and get started, there's a button there. Ask some basic questions and get you where you need to go. We also have loads of information and fact sheets and updated content for people to have questions. But, again, a couple of things. We encourage everybody during this SEP to make sure that you do enroll in some form of plan. There's options for you. And to take advantage of the benefits within those plans, which includes preventive care and vaccinations.
Well, Brian, thank you so much for joining us today and for sharing all of this information with us. We are so truly grateful for the work that you do with Get Covered Illinois. And thank you all for watching. I know that we still have a way ahead of us until we return to normal, but I am committed to fighting for you. Please reach out to my office if we have any questions. You can call us at 630-549-2190 or reach out online at underwood.house.gov. Don't forget to check out our other videos to learn more about the healthcare provisions in the American Rescue Plan and how you and your family may be able to save money. Take good care of yourselves, everybody, and stay safe.